Dr. Joseph Kanu understands that one way we can honor God is by being as healthy as possible. Dr. Joe believes modern science proves the healing abilities of remedies found in Scripture, and as a practicing chiropractor, blends those biblical truths with cutting-edge technology to enrich his patients' lives physically, emotionally, and spiritually. Welcome to Simple Truths for Healthy Living with Dr. Joseph Kanu. Listen for the next 30 minutes as Dr. Joe shares tips to help you live the healthy life God intends for you. To be a part of the show, call 313-838-1035. That's 313-838-1035. And now your host, Dr. Joe.
Well, hello, Metro Detroit. This is Dr. Joseph Kanu broadcasting from Rochester Chiropractic Clinic.
And this is Dr. Jeff Haddad from Rochester Advanced Dentistry.
Yes, and our show, Simple Truths for Healthy Living. You can listen to all of our shows, simpletruthsforhealthyliving.com. And last episode, Jeff, last week, we were talking about snoring.
Right.
A great topic, and the serious side effects of snoring. It's not something to be taken lightly.
No, it's kind of the butt of a lot of jokes, and I feel like it's almost like, oh, I'm a snorer or you're a snorer, and
you just accept it.
You
what do
accept
you
it.
do? What can you do about it?
There's all kinds of things,
and you don't think of. I never thought of it causing serious health. I mean, you talked about the carotid arteries,
right,
and all that. So this show, I'd like to maybe cover. I know you had something else, so I'm going to throw you a curveball. Okay, I would really like to cover what treatment. What do you do for snoring?
We can do that.
Can we do that?
Well, no, and to be honest, no, I'm actually.
I
feel
like
hesitation. No, we definitely can do that, and we will do that.
Okay.
I think that we also almost recapping last week and adding to it a little bit of, again, just the serious nature of just snoring. Because I think what you kind of hit the nail on the head, which is people say, oh, they just accept it. There's nothing that needs to be done. Well, that's true. I mean, we could do that with a lot of things, in life. However, if you know the negative consequences of it or the possible consequences, would you choose to do something about it? And I think that a lot of people, a majority of people would, especially when they hear the serious possible side effects and consequences of a snoring issue, whether it be health consequences or, we talked about last week, even marital and social type situations. All of this is part of quality of life. And I think if people at least have the information of what can happen if you don't do something, right. They may be inclined to do something about it. And when they find out how really easy the treatment can be and how comfortable an appliance could be that could truly save their life, I think that people will be much more open to something like that. So, no, you know what? There wasn't even a curveball involved. I think I caught your fastball, and I'm ready for it, all right? I caught it. I'm ready. I should have hit it out of the park, but I'm going to later.
You're going to hit it out of the park, Jeff, and we're going to do a short scripture, Matthew chapter 7, verse 12, the golden rule.
Ooh.
Okay, we know a lot of golden rules.
Yes, we do.
According to Jesus, do to others whatever you would have them do to you. Mm-hmm. This is the law and the prophets. That's what Jesus do unto others. And part of our show is, Lord, we dedicate this time to gaining more knowledge and wisdom and sharing it with others so they can have a more prosperous, healthy, vibrant, joyful life. In Jesus' holy name, we ask that you would guide our words and open the hearts of the listeners to be moved to do and take action of what they need to do. Mm-hmm. In Jesus' name, amen. So with us this episode, we have Dr. Jeff Haddad of Rochester Advanced Dentistry, and who is probably the most technical, most well-studied dentist that I know of. And Jeff, I know you travel all over. You're constantly going to seminars. A few weeks back, you did the bone grafting topic. If you haven't heard that one, that was a great show.
We actually brought a live patient out to the West Coast.
That was May 1st. We did that.
Yeah.
But anyways, so this snore, it really caught me, when I said I didn't know the mechanism of action you were reading
Right.
from Henry Ford Hospital.
Right.
Right here, our hometown
Hmm.
hospital did a study saying that snoring vibrates the carotid arteries,
Right.
causing them to thicken,
Correct.
and you're more vulnerable for strokes and heart problems, and uh,
And it makes sense,
it
but
does make sense. But you know what? I was thinking, pondering those thoughts
Mhm.
over after the show,
Right.
thinking, well, what about the thyroid and the thymus and other organs attached, in your throat and the glands? They're constantly being vibrated
Right.
all night. There's no rest for these, let
No.
alone your vocal cords. But
Well, let's go one step further. When does your body heal? When you get down to your good sleep, correct? That is how the body heals. When you get down to your REM, your refreshing sleep, that is when your body, after all day of action, reaction, physiologic tension, stress, all that, your body heals. If you're not getting good sleep, it won't heal. And there are numerous studies that connect poor sleep to so many different syndromes, whether it be fibromyalgia, whether it be a TMJ problem, whether it be seizure disorders. Okay, that can be aggravated by that. How about ADHD? We've talked about that
Why,
in the past,
yeah,
right?
I can't believe you said that, because I was thinking about. I remember that was about a year ago.
Yes, yeah.
I was
Yep.
covering ADHD, and I said,
Right.
Jeff, any dental problems with ADHD? And amazingly, you said about the study about snoring and ADHD.
Well, the study again that we talked about that, it said that more than 1/3 of the persistent snorers in this study were considered to be at risk of a behavioral disorder like attention deficit hyperactivity disorder, ADHD. These children may actually be misdiagnosed when really the real issue is being, essentially sleep deprived. And so you think
Sleep deprived and oxygen
deprived,
right?
absolutely.
And lack of rest.
You got
so
it.
their body's not healing. Well, you know how sometimes when your kids are overtired, what do?
Gosh.
They act up,
Oh.
they're whiny, they're misbehave.
Joe,
They're monsters.
They are monsters. And
Right.
how about this? Not to knock my family, but I have some family members, okay, that they don't put their children on schedules, okay?
Could I have names?
No,
or
you
not?
cannot, okay? Luckily, my family's large and
Yeah.
nobody's able to pin it, but they don't put their children on schedules. They kind of let them stay up late, and these children are night and day misbehaved versus these other kids that are on schedules that have good sleep. These are children. You need to guide them. You need to give them. They're going to stay up all night. Why wouldn't they? But it's going to catch up with them. And there are, these kids that are acting up in school, who are being mislabeled, put on Ritalin, and all these things could very well just have a sleep issue happening. So no, it is.
So that's definitely something to consider. If any of you out there have a child that has ADD, ADHD, or is misbehaving,
right.
It could be that. Instead of going to the drugs or looking for food allergies, it might be.
Well, the first question, what I ask parents, and I just got in this conversation with a mutual friend, kind of become a friend. Her daughter is friends with my daughter in kindergarten, and her daughter has a seizure disorder. They've tried everything. The first question I always ask for anything is, how do they sleep? It's like, she sleeps terrible. She's always slept terrible. And the next question, I said, well, does she snore? And she said, nope, she does not snore. Now, it's difficult for me to understand or put two and two together when if you're not sleeping for some reason, right? She doesn't sleep well. So what's the reason? My guess is that she is snoring, but maybe mom isn't aware of it. Or maybe there is a breathing issue, and it's such a low level that she doesn't hear it, but there could be a breathing issue, like more of a sleep apnea or even a sleep hypopnea, which is partial closure, partial airway cutoff. And
so partially, so you're still breathing, but you're not only getting a small amount of the oxygen, less an inadequate amount of oxygen.
Inadequate, that's it. And you want a certain level above 8. You want above 80 to 90% is really, and once it goes below that, it's compromised. And so I actually just sent Colleen 4 different article studies. I mean, I keep these things. You know me, I'm a nerd. And I
Yeah.
keep these things
Mm-hmm.
for patients so that because people need, I mean, you can take my word for it. I mean, a lot of people I meet right off the bat, they don't know me from Adam. So I would like them to have the research article so they can read it for themselves and educate themselves. And so when we talk about snoring, which is what we did last week, we're talking about a sleep breathing disorder. That's what it is, okay? And it is going to disrupt your sleep. You're not going to get down to that good REM healing sleep. Your body is going to be in what we call a dystrophic state, which means it's in disharmony, it's uncomfortable, all kinds of things. And you know, I was talking to Dr. Paul last week about people who are, and a good question for you to ask. And I know that you guys ask about sleep apnea. My question is, I feel like sometimes as physicians, we only ask one question, we get an answer, and we move on, as opposed to maybe a little bit more details. For instance, you know, do you snore? Yes, I do. Okay. The next question would be, well, have you ever been told that you have sleep apnea? Yes, no, or maybe. The next question is, how do you sleep? Well, what do you mean, doc? If you go on any medical physician's healthcare form, one of the number one questions is, have you had any disruption or change in your sleep patterns in the past like 6 months? I mean, you've read that a million times, right?
Right.
Why do they ask that? Well, it's to uncover some information or some possible problems. Here's the next question that I think is important. Do you sleep well? No, I sleep terrible. Okay. Do you mean that you have trouble falling asleep, or do you have trouble staying asleep? Well, what's the difference? There's a big difference. No, doc, I fall right asleep, but I just toss and turn. I'm waking up and this and that. I'm just a light sleeper. Well, you could be a sleep apnea person because every time you gasp for air, you wake up, you don't know why, and then you get back to sleep and you keep doing that. You could be a big clencher grinder because you skate off a tooth the wrong way. You go, oh, and you wake up, you don't know why. You said, oh, well, maybe I got to go to the bathroom. You go to the bathroom, but you don't know what disrupted you. Or you could be more of an insomniac where, no, doc, when I finally do get to sleep, I'm good, but I can't fall asleep for the life of me. Well, that's somebody whose body, what they've shown on much research, is in pain and discomfort. And that falls into your realm. Somebody whose body is in, again, disharmony, dystrophic, whether it be a lower back issue, cervical issue, something. They can't get comfortable. Their body is in this dystrophic, agitated state. And so, again, if you just said, oh, disruptive sleep pattern, yes. That doesn't say it all, So I found that I've tried to improve myself as far as the questions I ask people and the details that I want to get out of people, and then I think that's the first thing. But, you talk about how do we treat this? How do we treat a person who does snore, who does have sleep apnea? Well, it's very simple. The first thing is we measure you. We use what we talked about last week, which is the Apnea Link monitor.
So now listen up, everybody. This is the heart of the show.
Correct.
What do you do? So we've established it can cause all kinds of health problems, serious, life-threatening issues.
Correct.
What can you do
to
help it?
Well, the first thing that I do, like I said, is we measure. We need to get an indication of if you are a light, moderate, or severe sleep apnea person. That's based on what's called an AHI. And for those of you who have been diagnosed before or had a sleep study, you know that number. It's the apnea hypopnea index. It's the standard number that
apnea is stopping,
correct?
Lack of,
yep.
absence,
correct.
Apnea, and hypopnea is diminished.
Correct.
Right?
You got it. Partial. And there's a ratio of the two.
Amount.
And there's an index.
So this is like you said, your niece or whoever it was, she doesn't snore, she's breathing,
right,
but maybe only getting 50% of the oxygen.
You got it.
50% of the air.
Which could be aggravating her seizure disorder.
Jeff, and you know what this tells me? Our cell phone should have a link to something that's on our finger all night, all of us.
How cool would that be?
We should know what our oxygen level is throughout the whole night, throughout the whole evening, and if there's a problem, it should come up.
Oh,
right.
Well, for those of you who are listening, do not steal Dr. Joe's idea because that is brilliant, and we need to get a patent on that. the Kanu oximeter, the Kanu cell oximeter. I love it.
Yeah.
No, I mean really, I mean it is.
It would be so easy with our smartphones to do that, right?
Well, and it's information that you really need to know so that you can help diagnose something. I mean, I feel like, this friend of mine, they're just throwing things at the wall and hoping something sticks. Do a sleep study, okay? I mean, At that point, when somebody's had a seizure disorder, I wouldn't even mess around with my little monitor. My monitor is a screening tool, and it is great. But when you're talking about a 6 or 7-year-old who has seizure disorder, go in, have a true sleep study where they can monitor everything. I mean, they take it to the next level. Find out the information. What's a worst-case scenario? She's sleeping fine. There's good breathing. Well, great. At least you've ruled that out.
Rule that out.
Exactly.
Process of elimination.
You got
Move
it.
on to the next.
You got it. So, but
Okay.
but in our office though, we do use a screening tool. So this is what happens. It comes back. Here's the different levels. If you're below a 5 for this AHI, you are within normal and it's a safe level. 5 to 10 is light. 10 to 15 is moderate. 15 or above is severe. Now, if you are a 15 or above, the next step for you is my sleep physician, because you are getting a true sleep study, mainly because it will give us more information than I can give you. Plus, at that point, really, the standard of care is the CPAP, which is the air breathing machine that positively blows air into your body. And I know it doesn't sound that appealing to a lot of people, but if you have severe sleep apnea, it really is the right treatment for you. Now, let me go one step further. There are many people who have either tried the CPAP.
Very low compliance.
Very low compliance. We're talking about 30% compliance, and which is very low. It's very difficult. Now, I know patients that wear it and love it and swear by it. Good for you. You're saving your life. But the people who either can't or won't wear it, you need to do something, which puts you back into my arena. So if it's a light or moderate sleep apnea person, or a severe person who cannot or will not wear a CPAP,
right,
you're back into my office. Well, what do? What we do is we take custom impressions, and we actually take a measured relationship between your upper and your lower jaw that has been proven with 10,000 skulls and this and that and everything, research and articles and everything you think of that shows the proper relationship that opens up your airway to make it patent, which was what we want. We want it to have airflow. That's why you snore. When you fall asleep, your lower jaw falls back, cuts off the airway, and we have problems. What my appliance does is it keeps that lower jaw in the proper position in relationship to the upper, and keeps the airway open all night long.
Well, beautiful. So I know when I sleep, I notice my jaw retracts back.
You got it.
When I sleep on your back, right?
That's
you sleep
pretty
on your
much
back,
everyone.
nice pillow under
Yep.
your neck to maintain the proper cervical curve,
Mm-hmm.
but then your jaw seems to fall back.
Right, gravity.
And you're saying that closes air. I never related that to closing off your airway.
In fact, if you would like, I'll have to remind me
So
next time we're in my office. I'll show you the before and after of an X-ray, a 3D X-ray of with and without the appliance of the airway volume. Okay.
Okay.
In fact, Rachel, my assistant, we did the study on her. I believe we increased her.
Well, you really exploit your employees, don't you, Chef? Wow.
Yes, we
That's
do.
terrible.
It's part of the deal.
Yeah.
You know, we're all guinea pigs.
Do you ever hear them say, "I didn't sign up for this"?
They do say that, but
Yeah,
I
you just
ignore it. Yes.
You don't ignore. You don't hear your wife snoring. You don't hear your employees. You don't listen at all.
I hope
But anyway.
I hope the listeners and the patients out there appreciate what I do for them. All right,
Yeah.
I exploit my loved ones for you. My love and care never ends.
Yes. So this a bite appliance.
Yep.
It actually holds your jaw
in the proper position.
So then, because I notice when I'm lying on my back, I'm trying to keep my jaw.
Right.
But it's almost like I'm straining. I'm not relaxed.
You got it.
When I do it.
Well, not only
Are your muscles able to be in a harmonic, relaxed, peaceful, easy?
And that's why
muscle?
we do this specific measurement that I know where they should be comfortable, because of the reasons we talked about last week, which is an arbitrary internet bought over the counter that's taking nothing into consideration. You don't know if it's in the proper position. You don't know if it's helping you because you can't measure it. You also don't know, even if the snoring stops, that does not mean the apneas are stopping. I want people to know that. You can say, oh, well, I stopped snoring with it. Okay, unless you're getting measured. with either a screening tool like the Apnea Link or a sleep study that's proving.
It's measuring your oxygen blood level
Yes,
through
you
the
cannot
night.
say that that's being successful.
And by the way, you can test your oxygen through, superficially, right, with the little clamp on your finger.
Of course.
That doesn't hurt. It's not invasive.
Right.
It's not like we have to stick a needle in you.
No,
it's
absolutely
superficial,
not.
very easy.
Yeah, it's a little clamp. Yeah, a clamp is even it's more of like a light clothespin, I think,
Right.
whatever. And it's
Right.
just, that's all it is.
Well, it's like a clothespin that you don't even feel.
Exactly.
Yeah.
This is something that is not invasive. It's very easy to do. You've done it, Dr. Joe.
Yeah.
I've done it myself. I've done it several times. I've used different types of I exploit myself as much as my employees, believe me.
Yeah.
But it's about doing some research and development so that we know what works and what doesn't work. But really, in the end, we want to make sure that this appliance is doing the job. Now, let's go to the next level. I make this appliance, I put them in the quote-unquote proper position. Does that mean that no adjustments are made? Not always. I would say 75% of the patients don't need any adjustments to the appliance, and they're great. But there are 25%, because we are individuals, because we are each our own person, have different
Sure.
anatomical structures, we need to make adjustments. That's why this appliance is so powerful.
Even with your customized bite splint, right? It's a bite splint?
Yeah, I don't.
What would you call
a
it?
splint, I think, is restrictive. I don't like that word so much. It's more of just like an appliance that is that holds a relation. In fact, it's not a splint to the degree that it's an upper and a lower separate two pieces. Okay, you can move around, you can do everything,
really?
which adds to the comfort. There are some out there, the Tap appliance, there's the Oasis, there's a lot of them out there that the upper and lower is literally welded together. That never appealed to me. I've tried them; they were uncomfortable. And even those of you who are listening who maybe even tried one of those and they're like, I could never wear something like that. Please know that what we make is night and day different.
There's alternatives.
Than that. Oh, it's just night and day.
You have options.
Absolutely. But to answer your question, the measurement is very exact, but sometimes people's lower jaw just needs to be brought back, forward a little bit more. This appliance has a couple little mechanisms on it, and it's made so well. It's called the Somnodent appliance, and it's beautiful. And so we move it forward, usually a millimeter at a time. We're talking little increments here. And again, we just do a little bit. We'll do one measurement, 1 millimeter forward, go and use this for 3 weeks. If the snoring hasn't stopped, then we move it forward a little bit. But give it a few weeks for the tissues, the swelling to go down, all that. And, we had a woman who came in yesterday, a woman and a man. I thought about this person after you talked last week. You were so surprised that a woman would be the snorer and not the man, right?
Right.
This woman was extreme. She already was CPAP intolerant. She tries a CPAP, couldn't do it. Her husband was so adamant about saving her life. He did everything in his power to. In fact, they came in for a treatment conference. No, I give him so much credit because this was probably 2 or 3 months ago he came in. We talked about it. He said, you know what? I don't know if financially we're ready for this now, but we will be back. He just came back. We delivered her appliance last week, and I told her again, I know you're anxious to stop snoring. And I know to her husband, I know you're anxious for your wife to stop snoring so you can save her life. Let's not be over anxious. We don't want to overdo it and put you into a jaw pain or headache situation because, unfortunately, if you push a jaw too far, put something in an uncomfortable position, whether it be with a over-the-counter or even my appliance by adjusting it too quickly, you can throw yourself into a spasm. We don't want that. Let's be patient. Patience is a virtue here.
Yes.
And let's make sure we do it the proper way. And so she's going to wear it. She's been given instructions on how to adjust it because the patient's going to adjust it at home. It's a very, very slick thing. We give them directions and everything. And then in 2 months, they're going to come back. We're going to send them back home with the Apnea Link monitor. We're going to measure that appliance with it in her mouth. If it's where we want it to be, we're done. She continues to wear it, and everybody's happy. If we've made improvement, but we're not happy with it, then we will adjust things a little bit to make sure that we are at an AHI level that we're happy with.
Oh, great. You know, this other one, this over-the-counter thing you said where you're locked in.
Right.
I mean, I tell my patients, even if you're sitting in the proper ergonomic position, you're not designed to just sit there. The body's dynamic. We need movement.
Right.
That doesn't bear any witness to me to have your jaw just locked.
No.
And even if it was in the exact perfect position, all night long, not to be able to have any motion.
Static is not what the human being. I mean, we just weren't built that way.
Yes.
I mean, I love that word, dynamic. That is it. And
Yes.
fluid. I mean, we should be,
Yes.
in motion to a degree. And so, no, anything that's restricted is a problem.
And it's so great, Jeff, that you can deal with the snoring, not only the snoring, like you said, but this hypopnea where you're getting lack of oxygen for people, because it's adding so much life and vitality in years. You made a great point about a month ago where you said, hey, you can live without legs, but you can't live the fullest life you could have, right?
Correct.
And it's the same with snoring or getting proper oxygen.
Right.
Oxygen is?
Yeah, oxygen is king.
We need to say that every show.
It's like we'll have a little chant at the beginning and the end, I think.
Yes. Well, Jeff, I really enjoyed this episode.
It was good.
It's
I think we
always
covered this.
I'm learning so much. We've been doing this for 2 years. Every show, I learned something from you.
Thank
I
you.
learned about 3 things today.
I appreciate
it. I am blessed by having you.
Thank you. Well, I feel
and-
honored to be here, and I enjoy it. It's been a lot of fun, and I enjoy looking forward to the show and doing it, and I've gotten such great positive feedback from people, so I think we're doing a good job for people.
So this is Dr. Jeff Haddad of Rochester Advanced Dentistry. His phone number, 248-656-2020 or rochesteradvanceddentistry.com. You can listen to all our shows. What is the name of our show?
SimpleTruthsForHealthyLiving.com.
You're listening too. That's great, man. All right. And next episode, maybe we could talk about my favorite topic.
Yourself?
Myself.
I like that. Wow, I didn't.
Keep caught. You're fast. You are quick, man. All right.
Wow.
So anyways, that is it for this show. Remember, in all that you do, eat or drink, do all things to the glory of God. See you next time.
It all starts with a smile. At Rochester Advanced Dentistry, a new smile is waiting for you. Experience the differences when you walk in the door. Extraordinary comfort, a deep level of trust, an appreciation for beauty. With over 20 years of experience in the most advanced techniques in cosmetic dentistry, TMJ treatment, dental implants, and sleep apnea, Dr. Doolin and Dr. Haddad can give you the life you've always dreamed of. And it all starts with a beautiful smile. For more information, visit rochesteradvanceddentistry.com or call Rochester Advanced Dentistry at 248-656-2020. That's 248-656-2020. You've been listening to Simple Truths for Healthy Living with Dr. Joseph Kanu. If you'd like to talk with Dr. Joe, call 248-656-1011. That's 248-656-1011. And tune in again Monday through Friday from 10:30 to 11 for another edition of Simple Truths for Healthy Living with Dr. Joseph Kanu.
The content on this program is for sharing general information purposes only. It is subject to change with ongoing research. It is not meant to diagnose, treat, prevent, or cure anything. Dr. Kanu encourages you to make your own healthcare decisions based upon your own research and in partnership with a qualified healthcare professional of your choice.